So a new paper caught my attention on my social media feed where they were using tumor treating fields in pancreatic cancer combined with chemotherapy. So it's interesting. The tumor treating fields is actually not a new concept. It's actually an old concept popularized for use in brain cancer called like the Novocure is the company, Optune, where in glioblastoma you put on this like frequency mesh on your head and you're carrying this battery pack, and this field has some sort of anti-cancer effect on those cancer cells. And so this what's was really interesting is that this became popular in particular by there was a famous doctor named Dr. Stoop, where they actually created a chemoradiation protocol in glioblastoma. So it's called the Stoop protocol. And I think, he probably had some, some thoughts about, we need to probably change our approaches and kind of go outside the box. So he's ended up supporting or backing the use of these frequencies, in essence, like the Star Trek kind of gentle beams. That's like, it's not heat, it's not, you don't feel anything. It's kind of like like a cell phone kind of frequencies, so to speak. And, it was having this, anti-cancer effect. And it kind of opens the door to like people in the alternative world. They used to always be into these frequencies, the Rife generators and other things, and it was always kind of laughed about and shrugged. But now you have this FDA approved device, approved in brain cancer to try to increase the outcomes, and now they're applying it for different cancers. And now we're even seeing it applied in advanced pancreatic cancer with chemotherapy. Showing that it didn't extend it by like say by half a year or anything, but it was several months. But still, it's showing that this frequency concept could actually be applied to somehow help the body to fight cancer. And you have to realize there's a bunch of chemo drugs that's what all they're doing too, is just increasing survival by a few months. And but so it's kind of opens up this really interesting doorway that a lot of us in the field have been using. So for example, like I have this hyperthermia machine where part of it, yes, it's a heat technology, but the pioneers in the technology also feel it's the electromagnetic field that's created that's potentially helping to fight the cancer as well. And now a lot of this data is really opening that concept. So this whole time when maybe I was using hyperthermia for treating these kinds of cancers, and we're assuming it's more the heat technology, it actually could also be related to the radio frequency technology. Again, that's not, say, research specifically like in the Novocure device, but still it does open up that discussion that a lot of doctors feel that it's probably doing a lot of value. So it could be a 50-50 split. So anyways, interesting. And just I think it's just important for the people to understand that it's not necessarily about these super toxic or side effect profile devices, but something about electromagnetic fields and that having this effect on fighting cancer.